How do I meet documentation requirements but also respect my client's privacy? And specifically, how do I manage transgender issues in documentation? That is a question I've been getting much more recently. Hi, I'm Dr. Maelisa McCaffrey, founder of QA Prep and author of Stress Free Documentation for Mental Health Therapists. A while back, I did a full length webinar on YouTube Live that was all about how do you manage some of these more sensitive and politically charged topics in your documentation. So there were a whole series of questions that were submitted by mental health therapists all about transgender issues. So in this video, you're gonna see that segment so we can really dig into this topic. And so you don't have to go back and speed through that entire YouTube Live. So let's check it out.
Transgender issues. So let's get into this one. So first question is it necessary or reasonable to remove identifying things related to being transgender or undocumented clients? Should we avoid using pronouns? What about using gender dysphoria as a diagnosis? And related, there was another question that said, regarding adult clients, can you offer guidance about how to best go about documenting gender dysphoria, when or if to include the diagnosis and documenting symptoms to support it in client charts in the current political climate? So, okay. I think this is coming up a lot for therapists who have been seeing clients who are transgender and been treating them specifically for gender dysphoria and now are concerned about it. And so now it's like, it would be easier if a client was just coming in today and you could have policies and structures around that today. But what do I do about 2 years of notes for somebody that has all of this stuff in it that now feels a little concerning? So as far as pronouns, as far as documenting whether or not someone is transgender, my personal recommendation would be to default to what the client's preference is and to ask them. So to ask them literally, do you want me to include information about you being transgender? Do you want me to include which pronoun would you like me to include in my progress notes? And is that different from how you want me to talk to you in person, right? Those are questions I would specifically ask clients. Especially, I would say this is a group where when we talk about other sensitive information, certain clients aren't as concerned as we are. Some clients might be, but a lot of times many clients aren't. I would say this is a group where this is likely top of mind for this population because they are really involved in the healthcare system already, and it is directly related to that issue. And so I think for transgender clients, I would recommend bringing this up, even if they haven't brought it up, and talking with them very openly about it, giving them access to their records or reviewing records with them to talk with them about it, because that will be both empowering for them and help, again, clear some of that mysterious aspect of the documentation. And I think will help the two of you determine what is the best course of action. The answer here might be different based on different clients and based on different settings. For example, it might be different if you are working with insurance and the type of insurance you're working with, or where this person works, than if this is somebody who is less concerned about how this might impact their job and they're paying privately, right? So ask your clients about it, and that is what I would default to. As far as using gender dysphoria as a diagnosis, this is where I would love to say, if that is appropriate, then use that diagnosis. Here will be my caveat. It is fraud. It is technically insurance fraud to not give someone an accurate diagnosis. And this especially insurance fraud, to purposely choose to give a different diagnosis than would make sense and then aligns with, and that is different from the symptoms presented. And you might have a justifiable reason to do so. That is up to you. And again, I am kind of informed consent-wise, giving you the information and the options for you to make that choice yourself. I would encourage you not to make that choice alone. And if you are worried about it, to talk with that particular client and ask them again. For different clients, there may be different ramifications here. So asking them about it. Personally, I probably wouldn't document that conversation. I might document a conversation about doing a records review with the client. I don't think I would document much more than that. And that's a very legitimate thing to do. You could talk about you reviewed progress and did a records review. That's a very clinical task that any insurance company should be happy to see. So you can absolutely include that as your documentation, because this might be a whole session, right, where you talk about this and review different things and go through different scenarios with that person. So that's what I would recommend. I wouldn't say never use it, and I wouldn't say always use it. I would also make sure that you do have other diagnoses that might make sense. So if depression or anxiety or a trauma-related diagnosis also makes sense for this person, also include that because often they do, and that might help with a lot of the concerns that you have. So absolutely include other diagnoses as applicable and make sure that you have treatment goals related to those. So that everything is justified for continuing to see this person based on those symptoms and those needs. All right. The next person said, if you're supporting trans clients with gender affirming care letters, what do you document? Do you save the letter you wrote in the file? Again, normally I would say yes, that you would. If you wrote a letter that is very specifically related to the treatment you're providing someone, I would say yes, include the letter. And here is where I could say, okay, keep the letter separate. But just like we talked about with HIPAA and with psychotherapy notes, if you keep the letter, then it is still part of that person's medical record, and people could access it 100%. That would be a legitimate thing to assume. And I would assume that if you keep any such letters, that they are discoverable, right? That they could be accessed, requested, subpoenaed, etc. So do assume that. And then again, I would ask the client, do you have this letter? Do you have a copy of it? Make sure you do, if that's appropriate. Would you like me to keep that in your file? And if not, then you can simply say that you wrote a letter, that you wrote a case summary letter, or that you wrote a letter updating diagnosis and treatment goals, like a treatment summary letter. And so I think you could legitimately use that in your documentation instead of saying that you wrote a gender affirming care letter. And again, I mean, that's something that is going to be requested by the client and need an authorization anyways. So ideally you're having that conversation. But I would add to the conversation, not just about, do you want a letter? Who do I send this to? I would also add, do you want this in your file? Would you like me to keep a copy of this in your file, or would you like me to destroy? And those are the options. Would you like me to keep a copy of this in your file, or would you like me to destroy the letter after? Because if you cannot keep it in some separate place and expect that it is protected. So I would consider those two extremes, that it's either in the file or it's destroyed. Okay. Next question. So this is a little bit more specific, but I think also very helpful for everybody to hear. I'm a community provider that's independent, but for the VA. Among my clients are transgender veterans who have been receiving services through the VA. I'm required to provide medical documentation. They have been sent to me with a diagnosis of gender dysphoria. Of course, I always add on anxiety or adjustment disorder diagnosis. 2 of my clients have been denied continuation of therapy with me and there's no reason given. Moving forward, should I ever include a gender dysphoria diagnosis on any documentation? If I'm already working with these clients, should I omit that diagnosis in future documentation, even though it's the reason they were referred to me? So in this particular example, I don't think there's much benefit in not including it because, as you said, they're coming to you with that diagnosis. They will be receiving services through the VA. It's already documented through the VA. You can't get much more public than that. So like it's already there. And if it's in their file in the VA, it's likely not going anywhere. So I don't think that your removal of the information is going to serve any purpose unless you genuinely disagree and you would not include that diagnosis because you do not feel they meet criteria for that. That's a different story. So whatever way that you are working with them, I would, though, as I said earlier, focus on what are the other diagnoses that might be relevant and make sure that you have treatment goals specific to those diagnoses and that you are addressing those treatment goals in therapy as well. And I would just, I'm not saying this about this particular person, but because I do hear this frequently, I want to remind you all that, just adding random anxiety or adjustment disorder often is not good enough. Really do a thorough assessment and make sure that whatever the symptoms that are presented match the diagnosis that's given. And remember that adjustment disorder can only last for 6 months in the eyes of almost all insurance companies. So don't rely on that one all the time. All right. Another question I got that I wanted to address was very generic, and it said, how do we protect the LGBTQIA plus community? This is where I wanted to bring this up because, number one, I wanted to address all of the questions that I got. But number two, I think we really have to focus on individual clients. So as far as documentation goes, focus on your individual clients and all the principles we've kind of talked about already with informed consent and with talking with people and making sure they have access, transparency, and are empowered to make some choices. And then as far as protecting the larger community, that is really where I think then you go into the messaging you have on your marketing materials, your website, the way in which you present your intake paperwork, making sure that that is affirming or that that is very open, and any other advocacy efforts that you want to do. But with documentation, keep it focused on that individual client because it can be very easy to start grouping people. And still within that community, they may have different preferences, right? Each person might have a different preference for how they want you to document different things. So I would actually encourage you to keep it focused on the individual.